Good evening, all. Um, I'm excited to be here tonight and have the privilege to talk with you all. I'm going to be talking about coping and managing with frustration with your child. There are a lot of different things that we can do to recognize when frustration is about to come about, to help our children cool down and more effectively manage these intense emotions. So that's what we're going to be talking about tonight. And I'm planned to talk for a little while, but I don't mind. I'm going to pause and see if there are questions throughout. Please feel free to type into the chat too if you have questions as we go. Okay, so I have funding through the NIH, and I'm employed through Children's National and George Washington University, but I have no other conflicts of interest to disclose. So here's my plans for today to talk about where emotions come from, how can we help. We're going to go through 4 really key strategies for helping to cope with frustration, and then we're going to kind of wrap it all and put it all together. And this is where too we can talk about different applications or questions you all might have. Okay, so I'm going to start. I think folks in this group are probably familiar with this term, executive functioning. But I think executive function is really important to talk about with emotion regulation. Oftentimes when we use this word executive functions in school, we think about things like behavior and acting the right way, or acting in a way that you intend to, or being able to have self-control over that. Sometimes it can be thought of with planning and organization, or being able to perhaps shift from one activity to another. But another component of executive function, those are cool executive functions mainly, and another aspect of executive functions, what we call hot executive functions. So these are these areas over here on the right side, the ability to kind of be activated or stimulated to be able to regulate your emotions and solve complex problems. And so the field has really kind of categorized these different types of executive functions as cool and hot. Sometimes I think about these hot ones because the emotions can be very intense, and you kind of need them in a quick moment. Okay, so what is emotion regulation exactly, and how is it related to hot executive functions? So emotions themselves are really an internal subjective reaction to something that's happening either internally or externally, and they're brief in duration. Sort of a day-to-day way that we think about emotions is that they are how we feel, but it's very subjective. So there's no right or wrong emotion or reaction to an event or situation. But they can be influenced by hormones and neurotransmitters too, kind of the intensity or the type of emotion that we feel. And emotion regulation is this ability to have control over one's emotional state. And so this can involve behaviors like focusing on reasons to be happy or calm, telling yourself you've got this. It could be emotion regulation is also important for motivation and being able to kind of stick on a tough task or problem solve a way around this difficult task. It's responsible for having, signs of sadness or fear, or being able to rethink a really challenging situation, like not getting your way, in order to reduce anger or anxiety, or to behave in a certain way in a certain particular situation. And when children have difficulties with executive functioning, we really often see that it overlaps with emotion regulation challenges too. And so when executive functions are underdeveloped, this can lead to difficulties kind of regulating or having control over your emotions. And what this looks like is oftentimes children having more strong or intense emotion reactions to situations that perhaps their peer with more stronger executive functions might not have that same emotional reaction to the same stimulus or situation. So sometimes this means kind of reacting more quickly, intensely, or just more easily. I describe this as kind of going from 0 to 60 really fast, but also from 60 to 0 quite fast. Emotion regulation can also look like impulsive oppositional behaviors in the moment too. So when your parent asks you to stop doing something enjoyable, or when you're told you have to do something that you really don't want to do, that might provoke a negative emotion. And then that what we observe from that can look like either reactive or oppositional behavior when it's really driven by emotions, emotion regulation. So it's not uncommon for individuals with weaker executive functions to have very variable emotion regulation. And at times their emotion reactions to certain events might seem like that of someone that is 2/3 their age, which means when your child is, let's say 10, they might sometimes have a reaction that you would expect or would have seen from a typical 7-year-old at times. But it's not appropriate to say that they're not necessarily, emotionally immature per se. There's just these times where there's variability in their emotional reactions and that they may not be age appropriate. Okay, so having difficulty controlling your emotions to a situation, it can also difficulties with emotion regulation can also impact your ability to kind of stay on a challenging or boring task, because motivation and emotion regulation really are tied together. It can impact your ability to really problem solve and stick with a challenging task. And what this means is that individuals with difficulties with executive functions and emotion regulation really benefit from external sources of motivation, which means kind of having sources in the environment that reinforce when you use coping skills and you engage in a desirable behavior with managing your emotions, that we need to make sure that we positively reinforce those things in the moment in order to make the practice of these skills more likely to happen again. Okay, so how do we help? I'm going to be talking about some strategies tonight that are through what we call a cognitive behavior framework, or cognitive behavior therapy. Sometimes this is referred to as CBT. You might be familiar with that term. The cognitive behavioral triangle really is all about kind of how thoughts, feelings, and behaviors are related. So that's this visual here. It's sort of at the center, how we think, or what we think. Those are your thoughts, which really impact how you feel, which also plays into how you respond or what you do. And so cognitive behavior approaches really work on targeting one of these three areas, either behaviors, thoughts, or feelings, in order to change the other two. So what that can look like is when we work on challenging certain unhelpful thoughts or cognitions, then we can change what we do in the moment. Say that we are afraid of something and we're in our mind, we're talking about how scary it is and how difficult it's going to be. And the more we think about that, the harder it feels. If we start challenging those thoughts, then it's a little easier to do the behavior, and then we feel differently after. And so that's one example of how you can kind of target one of these three areas at once in order to kind of fulfill the full cycle. I have a brief video here about managing intense feelings, and this is through my colleagues' Unstuck and On Target program. And this video is about managing intense feelings, and it's one of my favorites. So I'll just play it and then we can talk about it.
For some of our kids, a little feeling can trigger a big reaction that turns that little feeling into a really big one. Sometimes we call these kids oversensitive or say their emotions can go from 0 to 60 in a matter of seconds. This is a problem with regulating emotions, and it can be a problem for all of us, even parents. The first step in helping kids to learn to better manage their emotions is to help them learn to recognize that their feelings can have different intensities. We can use a feelings target to do this. On the target, 1 is just right, and 5 is way off target. A big picture point is that you and your child focus on the intensity of their feelings instead of only on the feelings' names. When any of us are at a 5, for example, we're probably experiencing an overwhelming number of different feelings at once, such as angry and disappointed, as well as an intense amount of feeling. You can start to use these words yourself. You don't even have to use the target with your child if you don't want to.
I'm really upset and worried about being late. I'm at a 5, way off target.
Next, you can model doing something to help yourself feel better.
There's nothing I can do about the traffic. I'm going to take a deep breath and send them a text to say we're running late.
It's important to remember that when your child's emotions are out of control, like a 5, they're kind of like a storm. It's not going to do anyone any good to yell at, bargain with, or punish a storm. You just have to focus on safety. Take a deep breath yourself and wait for the storm to pass. Storms always pass. Even in public, your child's safety is the most important thing. Try not to worry about what others think. When you and your child are calm, you can try out different ways to feel better together. These will be helpful when your child is at a 3. See Preventing Overload for more on how to avoid getting to a 5. It is important to keep in mind that sometimes big feelings are justified and don't need to be controlled. At those times, it can be helpful to simply let your child know you understand those feelings in 3 or 4 words. That will help you and your child manage feelings better next time.
Okay. I like how the video talks about both adult emotion regulation and supporting that in your child, because this is something that really works best when it is practiced in the whole family. We know that by modeling these things, we're also helping our child, and it's really hard in the moment to help your child manage their emotions if you're also very frustrated and at a 5 yourself. And so making sure that you're practicing these strategies in this way too. And so some of what I'm going to walk through tonight has some kind of parallel practices for how you can do it as the adult, and then how you can also do it for your child. And we found in our programs that families really find this helpful to focus kind of on both simultaneously. But I'm interested in your all feedback too. So the first strategy that we're going to talk about is emotion recognition. Motion recognizing kind of our emotions is a very important part of managing frustration. Emotions can be very mild or very strong. And the stronger they are, the harder they really are to control. And so learning how to recognize more mild frustration or negative emotions, is really essential to managing these emotions. And it's much easier to cope with mild frustration than it is extreme frustration. So one of the things that we do when we're working with children and families, the very first session, we're going to talk about how we recognize our emotions. And so this is something that parents can do at home with their child too. It means talking about and labeling feelings and emotions, and it also has to do with kind of labeling the intensity. And so scales or thermometers kind of work really well for this. You can see here, there's like a very simple green to red scale. But we also have a thermometer handout too that I'll show you. So it's important to talk about what are different types of emotions you can share with them. Let's see, I think down, sorry, to move my windows. You can find on a feelings chart or a feelings wheel, if you Google that. This is just like one example that's helpful for starting to share and label kind of the feelings and what people look like when they're feeling different feelings. But even just starting to label what you feel in a response to a situation, and asking your child what they feel, and they can point. There's even simpler models that just show people's faces. When we talk about kind of recognizing emotions in children, we want to make sure that we think about kind of the whole child, because frustration and emotions is not just a mental feeling, it's also a physical one too. And so emotions that can be experienced physically also help, focusing on those can also help kind of a child or an adult recognize the clues to what they're feeling by paying attention to their body. And so there's specific, parts of your body that are particularly common in giving us signals, but everybody's a little bit different in what they might experience. For example, having a fast or a rapid heart rate when frustrated, or some people will describe like a tingling or fluttering in their chest, or physically feeling hot. These are all different signs of an elevated heart rate. Also, your stomach. So sometimes children describe kind of feeling butterflies in their stomach, or feeling nauseous, or they might get stomach aches. And other areas can be shortness of breath, muscle tension. This can be kind of like clenching your jaw or your chest or your neck, or it can be kind of like all over this feeling of tensity. Facial expressions. This is a great way for children to start identifying emotions in other people, but it can also help in identifying emotions in yourself. So sometimes just looking in the mirror when you're feeling frustrated, and helping your child to do that, to recognize what it looks like when they're making a frustrated face. Tone of voice, kind of say what people say and how they say it. So our tone of voice really tells us a lot about how we're feeling, and different tones of voice, and listening to those cues, whether we're starting to get louder or faster or softer. And these tones of voice can tell us how we're feeling, and how others are feeling in the moment too. One point about this, I like to remind parents, sometimes, especially for myself included, being sarcastic in the moment is one of my unhelpful coping mechanisms. That I might be sarcastic, and that doesn't help children with that are experiencing intense emotions in the moment to really learn about the kind of confuses with the tone of voice and what we actually mean, and how when they're learning to recognize emotions in others, and if we use certain tones, and we use them in the opposite way of how we're trying to teach the emotions, it can be really confusing. So one exercise in kind of teaching children how to recognize how they're feeling and what emotions, and where this has an impact on their body, and learning their different bodily kind of signals, is to draw sort of a body map. So a fun way to do this, you can kind of tape together, paper grocery bags, and have your child kind of lay down, and you kind of trace their body on the floor, and then have them, actually color in and draw on their outline with different, symbols or abstract art. It could be, it could also just be, magazine clippings or other things, or just, markers to draw in kind of how they feel when they're feeling frustrated and where they feel those things. So coloring in, sweaty palms or, feeling red in the face or butterflies in the stomach, to kind of help them in illustrating what those symbols are. You can also, use a smaller version and just draw a gingerbread looking person to do this body map exercise too. So this helps with learning kind of what are your early warning systems when we recognize where these are in our body. Those are helping for those early warning signs. So next we talk about, with children, we want to talk about identifying how much, so how intensity, what's the intensity of what they're feeling. And the reason that we do this is to really kind of learn kind of when we're at lower levels of frustration, and because that's when we can really apply those coping strategies. In the video, it talked about a 1 to 5 scale. Sometimes the simpler is better for younger children. So if they're probably, I would say, 6 and younger, I think 1 to 5 is a good approach. And for the little bit older children, say 6 and up, 1 to 10 or 0 to 10 approach or thermometer might be more helpful for kind of describing more sophisticated or more intermediate feelings of frustration. So when we talk about kind of how much we're feeling, this helps in identifying how you feel before they get frustrated, when they start to feel frustrated, how they're feeling when they get more frustrated, and how they felt after they got frustrated. When children have difficulties regulating emotion, one of the biggest problems we hear about is sort of these explosive, kind of being fine 1 minute and then really upset the next minute. And oftentimes it does move really fast through this, but identifying these warning signs is really important to managing these emotions. So what we do, an effective way for helping children to identify how they feel, is to use a feeling thermometer. So here's one example of that, but it could just be done verbally too, talking about the 1 to 5 or 0 to 10, but labeling the number of what you feel in that situation. In the video, there was the dad sitting with their child and talking about how it felt like a 5, running late, and talked about why and what was happening in the situation and what they did. And so by helping children identify when they're in this yellow zone or green zone or red zone, can really help recognize the feeling before it gets worse and before it goes into the really angry and boiling mad. Okay, so those are kind of how we talk about identifying and recognizing emotions. Are there any questions about what we've talked about so far? Any questions about how to just start these conversations with your child and talking about recognizing emotions?
And we have a small group here tonight, so if you would like to come off mute, you can absolutely do that and ask your question, or you're welcome to put your question in the chat.
Okay, I will give it a moment, and I can go on, but if there are other questions that come up into the chat, I don't mind pausing and talking about this. I think this is such a critical skill that is the foundation for these next strategies that we're going to talk about. So, okay, the next handout I have, and these materials, I have kind of full page versions of them that I can share with you all as well. This is a sort of a take-home activity to do later. This first one is showing how do I feel when I'm frustrated, and then there's one after this that talks about how is my child frustrated, how my child can tell that they're frustrated. So this can be done as a conversation, but I think it's really helpful to actually sit down, talk about it, and journal these things, to really think more deeply about how you and your child feel, look, and act when you have different emotional reactions. So what's my tone of voice like? What do I say, or what do I do when I start to become frustrated? How does my child react when I show those signs of frustration? What do I say or do once I become clearly frustrated? And what are the consequences once I say or do what I've done when I've already been frustrated or become frustrated? And a similar kind of similar activity that I encourage you to do with your child is the same exact questions, but for your child's perspective of what do they say, what do they do, how do they feel, and I think this is a great exercise, particularly for elementary school age or a little bit older, for starting to talk about these emotions and how they make us feel. And for younger children, I think this can be done, a great activity is with the body map and maybe more conversationally. Okay, so the next strategy that I'm going to discuss is a set of kind of cool down skills. I've lumped together a few different things into this broader umbrella that I call cool down skills. They're also called coping skills. These are really simple techniques that children and adults can use to calm themselves down when they're feeling frustrated or upset. And it's important to recognize that everybody has strategies that they like to use when they need to calm down at different times. But not all coping skills are effective. Some strategies might be really hard to do when upset, like just ignoring or walking away, because sometimes when you're, for example, in class, you can't always just walk away. So it's helpful to have for your children and for everybody to have tools in their toolkit, different options that they can pull on, because one might not work in a particular situation, and everybody's a little bit different in what works best for them.
Dr.
Okay.
Dvorsky, we did have a question in the chat. What if a child becomes frustrated or non-communicative when attempting to process their anger patterns?
Yeah, that's a great question. What if they become so frustrated that they're not speaking, or they're non-communicative for another reason, and they're trying to process their anger? I think when we do some of the visual exercises, you can do some of the recognizing emotions just by pointing. When you have that feeling thermometer, let me go back. This feeling thermometer, or even something simple like this one in the corner here. If this could be like printed out and put onto your fridge, you can point to this. And encourage your child to point to this and how they're feeling, to begin to recognize, and then you can kind of guide them to the next strategy, because what really matters is that they're identifying kind of where in this continuum of intense emotions are you, and so it doesn't necessarily have to be through conversation, and so if they're not communicating, you can do it that way. There's also the video talked about a storm. Sometimes a child might not be communicating because they have already reached the point of the red zone. They're already up here at the tip top of like feeling the most intense anger and frustration. And the best thing we really can do in those moments is to kind of ensure that they're safe and let that moment pass and not try to have a conversation in that moment, because usually anything that we say or do right then and there is just going to add fuel to the fire, and it can make the situation worse, but usually at best it's a conversation that just it's not heard, but at worst it could make the frustration even more intense. So it's better to wait until it calms down, comes back into the yellow zone, or in the middle area, or at least the orange zone, to then begin prompting the next coping skills. Okay, jump back. All right, so what cool down skills that we're going to talk about are three kind of main coping strategies or categories that help children to reduce distress when they're upset. One is self-talk, which is kind of using the coach in your head to talk to yourself. Use supportive language or self-statements to remind yourself that using your coping strategies might be helpful. Distraction. I often, when I'm talking about this with kids, I'll say do something else. So distracting yourself by doing another activity, usually something enjoyable or fun. And the third one is relaxation. So doing something that helps your body actually calm down. So these are things like deep breathing or counting to 10, or other relaxing activities.
Dr. Dvorsky, before you press forward, there's a follow-up comment to the last discussion. Waiting until the child calms down causes more anger or silence, like the silent treatment sounds like.
Yeah, that's a good point. Sometimes our reactions as parents to what our child's doing in the moment can be interpreted in different ways. And so if your child is actively trying to get your attention, and when they're frustrated, I could see how then starting to like practice active ignoring would really cause the situation to get worse or cause more anger. Is that kind of what you mean? Like when they're arguing or yelling back at you? Yeah. So in these situations, I like to first start with an empathetic response, recognizing you're really upset. I understand that you're not getting XYZ or what you want, or you're really disappointed about blank. This isn't a conversation we can have right now. We'll talk about this later, and kind of letting them know that you're going to start ignoring them, or that you're going to walk away. And then kind of, as long as you can ensure that your child is safe in that moment, that's what's most important. But sometimes if you taking away their attention is what is causing them to be so frustrated, it is going to go up and the anger can get worse. But what we know that how ignoring works is that when we continue to ignore, and if you don't give in, even when that anger does get worse, that eventually it will calm down and the storm, will pass. So what often happens is this pattern of whoever is kind of arguing or yelling or getting really upset, that then if we give in, if we start to give them our attention in that moment, then that can cause next time for them to kind of to yell or argue at that same level of intensity or even greater, because it sort of teaches your child that in order to get your attention or to get what they want, they have to yell and scream. So even if it's temporarily in the moment, the anger gets worse. We want to really practice that very difficult strategy of ignoring. I think that can happen in these situations, particularly in kids with weak executive function, because they can be so their emotions can also drive kind of their behaviors in the moment. And if they've gotten frustrated by something either that you've told them to do or not do or to stop doing, and you find yourself in that negotiating place, that's sort of leading to another behavior. Okay, I hope I answered that a little bit. I think Either way, it's going to be challenging to prompt coping strategies when your child is really angry at the top of their thermometer. And so this is not something that we can do until they calm down. So finding a way for your child to safely take that space. It doesn't usually need to be more than a couple of minutes. And then once they've calmed down just a little bit, then you can kind of prompt these strategies. These are great questions. Come on. All right. So let's talk about each of these three. I'm going to spend a few minutes just diving in a little deeper into each of these three coping strategies, and what they are and why they're so important for helping with frustration and managing frustration. So relaxation skills are especially useful for those physical feelings of frustration. So we talked about that body map. These are the things like the elevated heart rate or shortness of breath or muscle tension. And if you remember back to a few slides ago, I talked about kind of thoughts, feelings, and behaviors. Here, when we engage in these behaviors of practicing relaxation skills, we actually are calming our body down, and that action helps us to think and feel in a different way. And so because frustration can literally make children, feel bad, they tend to do whatever is going to give them relief in the moment from that discomfort. So that can look like crying, yelling, hitting, smashing things. And the more that they're physically aroused, this can really make them become kind of even more impulsive with those actions and have a harder time coming up with other solutions or better skills to do. So relaxation strategies help with reducing this physical arousal, and it makes it easier then to pick a more appropriate solution to cope. Relaxation skills, I think, are also great because they can be done anywhere, anytime, and this makes them particularly helpful in situations where children are not able to leave, like when they're with their peers, when they're with their friend groups, or when something doesn't go their way in the soccer game, or when they're in class. So when they can't leave or remove themselves from that situation, they can do these relaxation skills, and typically no one would even notice that they're doing them. Okay, so the first one is deep breathing. This is really about helping children to take deep breaths and do this in a very specific way. And likely you've told your child before to take deep breaths at some point, but many children don't really know how to take deep breaths. And so sometimes what I'll see that they'll do is they'll take loud breaths, but this actually gets in less oxygen. And so true deep breathing, comes from the abdomen rather than from the chest, which is called diaphragmatic breathing or belly breathing. And so what you want to do to have your child practice deep breathing is place one hand on their chest and have them place one hand on their stomach while breathing really slowly. And the hand on their stomach should, rise and fall, and the hand on their chest should stay pretty still. This helps in training them to recognize kind of what the difference is and how it feels. And so you can do that together to kind of show this difference. Another part of breathing in is slow breathing, and so helping them to take deeper breaths, and part of deeper breaths is having them really slow it down. I have two ways I like to do this. One is the 4-8-4 breathing. Sometimes this is called 4-4-4 or 4 square breathing, but it's to breathe in for 4 seconds, to hold your breath for 4 seconds, and then breathe out for 8 seconds. And that 8 seconds of breathing out feels really long, but trying to do that very slowly, releasing the air that you've breathed in. So you can do this by, you can count the breathing in, and you can count the 4-second hold, and then count the 8, and then gradually work on your child counting that in their head for the counting breathing. So that's the 4-4-8 breathing. And children can also, slow down their breathing by counting their breaths up to 10 and then having them start over again. That's a much simpler way of trying to slow down breathing as well. Okay, another relaxation, and one of the easiest kind of ways to help children relax their bodies is by doing something called tense release muscle relaxation, which basically means that the child makes their muscles as tense as possible for a few seconds and then lets go of all that tension. And so there's a couple ways to do this. The first one on the slide talks about the tin soldier wet noodle. And so this is a full body tense release activity where the child stands perfectly still with their arms at their sides like a tin soldier. And then they release and let their whole body go limp like a wet noodle. And so this can be, done sitting down or standing up. And this helps that full body kind of release is what kind of helps the body to calm and relax. You can also do various different muscle stretches where they kind of tense and then release just one part of the body. And there are a lot of great sort of more child-friendly ways to do this. If you YouTube kind of muscle relaxation for children, you'll find different activities. Like one is that'll walk you through the audio of this. One is like a lemon squeeze, where you imagine having a lemon in your hand and you squeeze it as hard as you can, and then you let it go. And it talks about how the lemon juice is dripping through between your fingers, and so it kind of does this imaginal practice with the muscle relaxation, which is really helpful for children. And there's some other examples here too, and families I know can come up with their own kind of creative ones, but the idea is that you're picking and kind of targeting one area of the body, and this might be an area that you talked about when you did the body mapping that's going to help kind of tense and release those parts of your body that get really worked up when frustrated. Okay, and the last one is the relaxing imagery. And so when children do sort of imagination practice, or they kind of imagine being somewhere calm and quiet, and you kind of describe various different senses of what you smell and see and feel and touch, that this helps to kind of imagine someplace calm, and this really has a physiological impact on ability to be able to calm down. And so this can be really helpful, especially if there's frustration problems at bedtime, or needing to kind of calm down. You can describe kind of a place that's one of their favorite calm, neutral place, and how it looks, how it feels, what's happening around it, how it sounds and smells. And this can really help with calming down. Okay, so the second strategy is distraction or redirection, doing something else. And so oftentimes when kids are really frustrated, they can become fixated or really stuck on that frustration, and it's hard to move forward or shift away from that. So they might refuse to stop arguing. They might have a hard time stopping what they're doing, because even if they find it frustrating and having a hard time letting go. Sometimes this looks like needing to have the last word in an argument, and children we can encourage them to find ways to distract themselves by doing something else in the moment that's fun, social, calming, and kind of once they're engaged in that activity, usually they find that they forget all about what was ever bothering them. And this is because in the moment, those feelings feel the most intense that they're going to feel. And so if we even just spend 20 seconds away from those feelings and doing something else, then we usually can come back and have a more full picture of how big of a deal is that thing that I'm getting really frustrated over. So this distraction technique is something that can be used by children for themselves too, of finding something to take a break from those emotions for a minute. So the activities most effective at reducing frustration tend to be physical ones, but not aggressive. So not punching pillows or competitive, but going for a walk or getting outside, shooting baskets, creative, social, or calming. And here's a table of some different examples of some of these different activities from families that I've worked with and what they found helpful in the different domains of physical, creative, social, and calming. But what you want to do is brainstorm these choices. Kids respond really well to choices. So talk with them about some options that they might engage in within the realms of what's possible in your home and where you live and what they could do. And if this frustration management is something you're working on at school, then you can kind of apply this within the school context. So what are their options for doing something calm, social, creative, or physical in those moments? Come to the table with some ideas of your own, but really get your child's input and fill in different activities that they enjoy, that they could do. One thing I'll say about this, the things that you put on this table, you want to make sure that they are not things that you would ever put into a contingency management system or a reward system. So they need to be things that you can't sort of take away, or they can't be privileges that you would take away from them. So they kind of need to be there and be options that they can do this no matter what if they're feeling frustrated. All right, and then the third one is self-talk or coaching. So this is when a child really is their own kind of coach on their shoulder and coaches themselves through a frustrating situation and helps themselves to stay calm. So when we teach children to really verbalize the statements out loud, this helps to really maximize their impact. And self-talk strategies can be very, very helpful and effective at reducing frustration, but they can also be really difficult to get children to do. And so practice with this third one is really, really important. Both practice in verbalizing it yourself and when you're walking yourself and talking to yourself, talking out loud. Even if you feel like your child's not listening, you're in the kitchen making dinner and you burn your finger and your child's sitting at the counter doing some homework, and you think that they're not paying attention, still practicing how you'd walk yourself through that self talk to reduce your frustration. This is going to help in modeling. And initially, when you're trying to encourage your child to do this, they're going to really need help walking through this ahead of time. I like to come up with self-talk language and things you can verbalize and say before the situation comes up. So before you're already worked up and mad and upset, what are things that you can say, and what are kind of these coping thoughts that you can come up with. When we kind of rehearse them when we don't need them and we practice them when we don't need them, then they're more likely to be there when we need them and can pull on them in the moment. Sometimes kids benefit from having those self-talk statements, written down on like a note card and kept somewhere where they can go to and just like pull out and read through when they're feeling frustrated, and having different options for things that they can say. And here's some different quotes that help with getting that started. All right, and then I've got two kind of practice at home worksheets to share with you all. The first one, is a practice activity for parents to think through situations where you can use self-talk or coaching, the doing something else, and the relaxation, and what you can say or do in those situations.
Dr. Dvorsky, before you move on, we do have a question in the chat. For the strategies that you talked about prior, How do you utilize those strategies when a child also has autism and they engage in scripting or other repetitive behaviors?
Yeah. I don't know. Does do Marcy or Yvette, do either of you have any suggestions of what you might recommend?
I would defer to Dr. Beth JJ.
Dr. JJ is the one who asked the question.
Yeah.
I was just asking this question because I know we do have some parents and their children have like the co-occurring conditions, and a lot of the concerns sometimes when they contact our office is with the scripting and those kind of repetitive behaviors. And I'm just thinking about how, like, I think the strategies you provided were great, but I was specifically thinking about like the self-talk and like
Mhm.
kind of calming down. And for kids who may have echolalia, like how do you get them to really internalize those strategies? And how do you know that they're being internalized and not just being repeated? Um, or would you suggest another approach?
Yeah. Yeah, I think that's really hard. I think I would probably suggest another approach. Um, the self-talk and coaching strategies in general, I think are really hard. And they're really hard for kids with neurodevelopmental differences too. I think sometimes they can backfire a little bit, and um, it is challenging to know when when is it really being internalized or not, and it requires a lot of repetitive practice um, to get to that point. I think one way to kind of see whether this is a strategy that's like sticking, or whether this is just you kind of repeating back what you heard, could be to like engage in more of a conversation about the situation from a functional behavior like standpoint of kind of talk about what was going on, how did it make you feel, what were your thoughts, and if you're having a hard time kind of connecting the thoughts, feelings, and behaviors, sometimes it can be done as a like reflection after the fact. Um, Sort of, there's no like right or wrong answer, but seeing how do those feelings connect to the behavior and the thoughts, and just going back to a few slides ago where I had like thoughts, feelings, and behaviors, and just talk about um, the connection between the thoughts and the feelings a little bit. And if there's clear kind of understanding there, then I think this is a useful approach. But if it's difficult, then I'd say I might practice other approaches.
Thank you.
Yeah, we often hear that youth have been taught the 3 categories of strategies, but they still don't apply them any advice. Yeah. Um, all of these strategies, I think, are hard for children to do on their own. And even if most children, they don't want to be frustrated, despite what it might look like in the moment. They don't want to feel this way. But it motivation to not feel this way or to not feel frustrated in a child is still not enough to actually overcome the barriers to practicing them and doing them in the moment. And so I know this isn't probably exactly what you want to hear, but repetitive practice is really important. I mentioned, earlier, like talking through these strategies and practicing them on a regular basis, even when you don't need them. So, the relaxation approaches can be something that you do. You can schedule time to do after school together, or it could be part of a bedtime routine. But not making them just bedtime, activities, really tying them to how these actions and these practices help us to feel more calm. And I think modeling them in the moment, and finding ways to, a lot of these sort of emotion regulation strategies can be talked about in school. So you might talk with your child's teacher about how do they label and talk about these things. Sometimes they might have like a little bit of a different spin on it. And if we use the same language that's used in the classroom to prompt these same behaviors, that also really helps in reinforcing doing the behaviors. I think, and then the last thing that, is it's modeling, it's reinforcing and prompting in the moment. And I mentioned earlier how motivation is tied into emotion regulation. This means that kids often really need to have the practice of the skills be reinforced by an adult. So that's things like getting positive descriptive praise for using a coping strategy, being given privileges for practicing this so many times a week or in certain situations or when things come up. And it might feel kind of funny to reward these behaviors, but we really want to see them continue. And when practice of each of these strategies isn't happening, the best thing we know to do is to try to build it into some sort of behavior reinforcement or reward system or plan. So those would be my main recommendations for helping things to stick. Okay. All right, 7:30. I'm going to talk about two more strategies. This next one is problem solving, and problem solving is a very kind of collaborative activity. This is these skills that we're talking about kind of get more advanced as we go and kind of more complicated. So they either require more adult involvement or parent and child working together doing these things collaboratively. And we wouldn't expect a young child to do these things independently. And older children can gradually do some of these things more independently with practice first. So problem solving is very helpful for frustration management because it helps children in situations where they feel like they can't kind of get out of or they feel stuck and they have a hard time thinking of other alternatives or other things to do. Some problems have obvious solutions, but those problems can be very difficult to solve, and children who struggle with executive functions usually have a really hard time solving those problems, and that's what leads to frustration more. So there are 5 steps to kind of that spell out the word steps to problem solving. And the first one is stating the problem. Sounds really simple, but it's hard to overcome a problem if we don't know what the problem is. So first, just talking with your child, what's going on, what's the problem, and what's happening. Then the T is think of at least 3 solutions. And so at this step, you want to help your child just with there's no right or wrong. Think of good and bad solutions at this step. We're going to have at least 3, possible solutions. We know not all of them will work, but the idea is that this step is helping your child to be flexible and sometimes it also helps to come up with like a really bad solution when you're doing this with your child, or a silly solution like use a magic wand to make this disappear, because this can these like bad or silly solutions can make a child better identify what's more realistic solution or more a better solution. Okay, and then the E is evaluate what is good or bad about each situation or each solution. So you go through, we made this list of 3 things. Now let's talk about what's the pros and cons of each of these. If we were to do this would work, but then this would happen. So it's important you think about the consequences of each solution that were suggested and whether or not the child could actually use those solutions. And then the P is pick the best solution and have a backup plan in case that first solution doesn't work. And the best solutions aren't really, they're not necessarily something that's just effective. It's what the child is able to do. So we want to make sure we're setting sort of achievable solutions here. And if the first one doesn't work, we want to have that backup plan, because that's a step that kids with executive functioning difficulties, often skip. So that's the last one of C. The S is see if it works, and if not, you circle back up to come up with additional solutions at the T step of think through at least a few other solutions. Okay. So when talking about coping strategies, problem solving steps and solutions, or even just prompting specific cool down skills to do, including problem solving, I think it's really important to talk about this concept of choices and consequences. This helps give children control over their frustration, and it helps them empower them to really use those skills and those coping strategies in the moment if they feel like it was their idea or they had some autonomy in choosing what to do. And so if in the moment you're able to recognize, okay, you're at a 3 or a 4, your choices are to go to your cool down spot and practice deep breathing, to use your coloring book, or to go and read through your self-talk coaching statements. Which of those choices do you want to do? So prompting your child to choose from those options that you've kind of laid out, and that helps to prompt them through what the options really are, and allows them to have a choice in what they do. The consequence part is about kind of engaging in a dialogue where you talk about what not only kind of led to the frustration and identifying the intensity of the frustration, but then what happens after that frustration. And so when you use the problem solving steps, this works really well to sort of reflect on what happened after you used that specific solution. What were the consequences of it? What were the consequences of not doing it? And this helps in kind of making connections to future situations. All right, so we have got two examples here. This one is an adult example of how we worked through to practice problem solving steps, just to help give an idea of how it can work. And then we have some practice strategy worksheets for practicing the problem solving steps at home. And there's one for children and parents here. They're pretty much the same. The prompts at the top kind of give you, if you're not sure what situation to do this with, there's an example here of thinking through something that causes conflict or has been causing conflict between you and your child, and think about how you can solve that conflict that keeps reoccurring. But it could be used in many different situations. That's just sort of one prompt for getting started. Okay, just gonna check before we go into the last strategy and see if there's any other questions in the chat, and I don't see any. So I'm gonna keep going unless folks have anything you want to come off mute, if you have any questions about problem solving or the other cool down skills. Okay, so the last one is another kind of more cognitive approach that has to do with identifying thoughts. I call these bear thoughts, and I'll go over what they are, but similar to how we label and identify feelings and emotions, we also want to make sure that we talk about the thoughts that lead to those feelings and the behaviors in the moment too. So this is a a harder step to do in the moment. It's a lot easier to do when you're already calm. And you can practice this outside of feeling away of when your child's already feeling frustrated, and then you can encourage them to do this as part of their cool down strategies when they are experiencing more mild levels of frustration. So what are bear thoughts? These are thoughts about a situation that make a child feel more frustrated, angry, or upset. So these bear thoughts, while thoughts that help them to remain calm or in control of their behavior, those things are called coping thoughts. These are sort of the opposite of coping thoughts, right? They're the bear thoughts are the types of thoughts that just lead to even more intense negative emotions or frustration. So this could be blaming yourself or others, the situation, exaggerating in your thinking, assuming the worst, or reading it wrong. There are a lot of, I use the BEAR acronym for when I'm talking about frustration management, but there are a lot of different types of sort of unhelpful thinking that are often thought of as like the opposite of coping thoughts. And we like to talk with children about identifying these different types, because there are many different ways that we can have unhelpful helpful thoughts, and labeling those thoughts as such. So saying that that's a bear thought, or that's an exaggeration thought, or I was assuming the worst in that situation. Similar to how you want to identify and label emotions, when we identify and label these thoughts this way, we're much more likely to come up with a coping thought when we know how to identify that bear thought. Okay, so coping with frustration from one of a cognitive approach, which has to do with kind of changing or recognizing and changing these bear thoughts, means that we are trying to identify that the bear thought is happening and then come up with an alternative thought. And those alternative thoughts are more realistic and more balanced, and that's what we call these coping thoughts. It starts with identifying the situation and coming up with what's happening in the moment that's leading to the bear thought, labeling the bear thought, and then coming up with an alternative thought. And I'll walk through how this is done. Oops. Okay, so you start with just talking about what are you thinking about right now, or what was going through your mind in this situation. Sometimes that question is a really hard question to ask a child, even an adult. After the fact, once calmed down, kind of being able to reflect on what you were thinking about in a past or future situation, it's really hard. So sometimes I like to back it up and start with, what was the situation that was causing you distress, and talk about from the cognitive behavioral, talk about what was happening, what were you doing, what were you feeling. You could label the feeling and the intensity, and then move to what do you think about that now, or what were some thoughts that you had about that. And so when we start by labeling the thought there, or writing down what the thought was, then we can label the type of thought that it is. So these bear thoughts really can have the tendency to run wild if we don't tame them, and we don't come up with kind of the flaws in that thinking. I talk about how our these bear thoughts, unfortunately, if we don't identify them, they can really run over, and then they can take over and control the situation. And we want to have more control over how we feel in the moment, to act how we want to act, and that's how how coping thoughts play in. They help us to make better decisions in the moment for these situations. So here's another handout with other types of this, similar to the bear thoughts. This again, these are just other kind of thinking traps that we can all fall into. Where the idea is that you learn about different types of thinking traps that everybody has, and learning to kind of label them when they happen. And so here's some other ones that come up that are really common as well. Okay, so how do we escape these thinking traps when they happen? I talked about identifying the situation, what's going on. I find it's helpful to either ask questions that where you can sort of act like a detective or a scientist. So thinking about the situation that we're trying to solve, solve this this query, solve our hypotheses, and figure out what you were thinking and what you could do differently. So this is done by asking, open-ended questions. When you ask about things from a like a scientist or detective standpoint, you're thinking about, from an objective standpoint, or from somebody who wasn't there, what would they say about what was happening? Usually people can understand something a little bit better if it's happening with someone else. So a good one for kids is kind of, if this was happening to your best friend, what would you tell them to do? Or what would you say to help them to feel better? And oftentimes that's a little easier to come up with a coping thought when you think about it from someone else's perspective, and then think about how you would say that then to yourself. All right, so the last couple slides I have, I want to talk through just putting it all together. Kind of what do we do when, and what strategy to use where. Before I do that, I had this visual of the cognitive triangle again, and that I just wanted to show again, to just reinforce that what we're trying to do here with all of these strategies is kind of changing feelings, thoughts, and or behaviors. And so some of those strategies, like the relaxation, target behaviors. The bear thoughts, the bear thoughts really focuses on the thoughts aspect of the cognitive triangle. And the first things we talked about really focus on recognizing the feelings and connecting those to different behaviors and thoughts. And so you can really change or focus your efforts on any one of those three areas and make impact on all of the other two. And sometimes trying to tackle too much is difficult. And so if all of these strategies that we're talking about tonight are pretty new to you or your child, I would say start with one that seems achievable now, and then introduce others as you've gotten to practice those. And if some of each of these have been introduced before, and you're at a point where you're having a hard time getting your child to practice them, then maybe talking about which situations work better for different types of frustration that your child might experience, and what would be the most helpful coping strategy to use in the moment. And that's another form of kind of using those problem solving strategies. Okay, so putting it together, which strategy should I use? Well, my answer is going to be that it really depends. Children are all different, and you all are the experts of your children and your family. So you are going to know best kind of which of these things that I'm talking about could work well and which may not work very well. That's why we really emphasize this toolkit or toolbox that they can choose from. Some children are really able to use that self-talk pretty well. Others might prefer the more active strategies like distraction or doing something else or relaxation. Some children use different strategies at different times, and what matters most is that you work with your child to feel to practice these strategies to really feel more natural to them and find what's easiest for them to use when they're upset. Okay, ignoring and walking away. We talked about ignoring a little bit. So why do we not just teach children though to ignore and walk away from situations? Although this can be an effective strategy at times, there are various scenarios where that might be the strategy that they're told to practice at school. But this is really, really hard for children with frustration difficulties to do, especially those with neurodevelopmental differences, given their weaknesses in self-control and impulse and emotion regulation. It's hard to do those, to walk away and ignore when they're upset. The ignoring, especially because it's sort of the action of doing nothing, right? You have to, just ignoring just means kind of not saying, doing, or thinking about necessarily anything else. But if you engage in, like, let's say deep breathing or the belly breathing, you can effectively ignore someone sitting next to you saying something really annoying repeatedly. You're giving your child something to do instead of telling them something, the absence of a behavior essentially, which is kind of what ignoring can be. So it's a little easier for a child to do something rather than to not do something. And it's also important that children learn how to actively reduce their own frustration rather than relying on more passive strategies like ignoring or walking away. Okay, so this is a really complicated flow chart here that walks through a variety of the coping strategies that we talked about tonight. The main thing that this is trying to convey, we call this in our programs the frustration expressway model. Thinking about how there's something that happens and that situation triggers either going to the frustration express, really getting quickly going into feeling your body feeling aroused, negative thoughts, emotional distress, feeling stuck or making bad choices about what to do. And that leads to more consequences and more frustration behaviors. And so what we're trying to do is recognize how these all kind of compound and happen really fast, that they can kind of cycle through these emotions very quickly. But each situation, each step of kind of the negative point of view, body feeling tense or aroused, frustrated thoughts, or making bad choices about what to do, each of these is also an opportunity to apply a coping strategy. So I know this is a lot on this slide, but the main idea is to try to take away that depending on the situation and whether the issue is about thinking or whether it's about body arousal or the point of view or making bad choices, that each of these are different ways that you can cope. And these are all opportunities to kind of pull your child out of feeling frustrated. And we want to make sure the very last at the bottom right is positive consequences, that anytime they move into the direction of starting to engage in these coping behaviors, that we provide positive consequences which reinforce and make this a positive experience for children for practicing the really hard coping thoughts. All right, and I have a few different resources. You can, I think the slides will be shared with you, and you can go to that QR code. We have some great video resources for youth, including some videos on emotion regulation. I know the video that I showed earlier was for parents. This one is for youth and teens as the audience. And it's also available in Spanish and Mandarin and English. Here's additional executive functioning videos. That emotion regulation one came from this set. So if you'd like to see more,